I think you're going to be thrilled with the content and information that we're sharing today and the terrific speakers that we have. And first, I want to introduce Dr. Shay Tanis. She is at the University of Colorado, and some of you may be familiar with the Coleman Institute for Cognitive Disability. She is the co-director of that and the director of policy and advocacy. And many of you may have seen the State of the States, which is just the resource with data on long-term services and supports and state information that she has been responsible for many, many years of collecting and reporting on that data. And Shay's area is around cognitive accessibility and technology, and leading the Tech First activities around the country. And so she's going to be sharing hot off the press information about Tech First and what's happening across the country and some of the data. And I'd like you all to be thinking about that in terms of Arizona and applying that concept here as we move forward, thinking about the information that she has to share. But on a personal note, I have to tell you, Shay is just someone that I respect in this field. I have worked with for many, 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 many years. We've had some grants together, and she is just one of the best, most genuine experts that we have in the field today. And I can't tell you how incredibly happy I am to have her here talking to all of us today. So I'm not going to take any more of her time. I'm going to let her have it. So Shay, I'm going to turn it over to you now, please. Thank you so much for joining us.
Well, thanks for having me. And it goes both ways, Wendy. We have, colleagues for a very, very long time. And it is always an absolute pleasure and so much fun when we get a chance to work together. So this is just another option that we get to see each other, virtually, but also share, because I think a lot of the things we've always done have overlapped, and we've been able to move the needle on quite a bit of really innovative practices. So I'm excited to join you all today. I'm going to go through, as Wendy said, some of the national trends that we're seeing in technology first, some of the practices that we're seeing as applied to employment, as well as kind of some other background information. So as Wendy said, I am co-director at the Coleman Institute for Cognitive Disabilities, where we look at advancing and catalyzing nuanced technologies, specifically applied cognitive technologies, to improve quality of life for cognitive disability. So that's, the broad range of cognitive disability falls into IDD specifically, but it also includes traumatic brain injury, severe and persistent mental health, stroke, dementia, etc. So it's a large range of cognitive disability, but we look at it from the functional perspective of disability. And so I'll talk a little bit about that and why technology becomes so important. We certainly have been, espousing the importance and the right to technology since our inception in 2000. Have pushed through some legislation, have also established some competitions, national competitions on disability. But pulling it all together, we're seeing quite an interest in now. It's the environment is right, the context is right for technology really to advance. So I'll talk a little bit about also what we're seeing in light of COVID, and how that is impacting what is now a real quick adoption of technology supports. So as Wendy said, I'm also the PI for the State of the States and Intellectual and Developmental Disabilities Project of National Significance. We're a longitudinal data project where we specifically track expenditures in the states for services and supports in IDD. And so some of this, well, you'll see my hats, I transition in between hats pretty quickly, and a lot of the things I do overlap, and you'll see where some of that overlap comes in. So I'm going to go through quite a bit, but I want to allow certainly some time for questions, because I'm sure there will be, particularly in light of COVID and what we're seeing. So certainly the ubiquity and utility of technology is something we've been looking at and kind of capturing. We know that, people are going to be connected. Everyone will be connected. And now we see that connection being so important for self-isolation, for loneliness, as well as delivery of services and supports. But this ubiquity of technology goes on beyond the IDD community, beyond the disability community. What we used to see in the environment used to be these folks constantly on their phones with our necks down, hunkered. That hasn't changed with the pandemic. In fact, that may have increased with the pandemic as folks being on getting Zoom fatigue. I'm sure many of you have experienced that Zoom fatigue these days, constant virtual meetings, as well as how do we connect to people now? A lot of times we're connecting virtually and through technologies. So, you know, the data we've been tracking nationally, we expect to increase in terms of utilization and applications of technology. But what we do know certainly is that people with disabilities are missing out on the advantages of technology. So there's a significant gap in the utilization and application and adoption rates of technology for people with disabilities, particularly those with IDD. Talk about how they don't have access, don't have information, don't have hardware, software, etc. Well, we know that people with disabilities are less likely to go online. We know that they have lower adoption rates. 39% of people with IDD had access to a smartphone versus 98% of folks in our national population. People with disabilities have less confidence in their utilization of technology. We have quite a bit of projects we've worked on how to use social networking, etc. But we need to work on that training and competency levels, digital competency skills. And they're also less likely to use social media as a means for building social capital, which is an integral place that we're seeing a lot of information sharing right now during COVID. So there's this tremendous digital gap. And so as I mentioned, the State of the States project, which tracks expenditures of supports and services in IDD, we've been tracking data on technology supports. And you'll hear me transition because the terminology is very important, as we've seen through technology first implementation in states. You'll see me transition from a phrase calling them technology supports to technology solutions, which is the terminology that we're really advocating for at this stage. But we started in 2007 tracking what were waiver services that were more identified as technology. So we started looking at personal support technologies, things like assistive technology, smart home technologies, and remote monitoring technologies. And as we've seen through the years, we've certainly seen an increase in the utilization, but we know this is an underrepresentation. So our data comes directly from the state DD agencies. That means it comes from our Medicaid agencies that are paying for waiver services, specifically the HCBS waivers. And we knew that there was a drastic underrepresentation of technology utilization. It was low, but we knew it wasn't to this extent because we do know that there's data out of the ATAP programs that show adoption rates of technology supports. But when we got our data, you know, we were tracking simply just one of the areas that I will highlight for you is remote supports. Started as remote monitoring in the terminology, has transitioned now quite a bit. Some states are still using remote monitoring, but we've transitioned to talk about remote supports. And back in 2000, or when we capture our data, we're on a lag because we use financial data. When we captured our 2017 data, there were only 652 people nationally that were reported using remote supports. There were only 4,676 using individualized personal supports. Now we know that's not, you know, when we look at the numbers of people that are providing services, the number of people in supported living situations, that's a very low number. And we've just seen Ohio double that number in 2 years for the remote supports because of their emphasis. So what we did to be able to address kind of what was the data gap, the information gap, was to go directly to the state agencies, the state DD agencies, work through our partners at the National Association of State Directors of Developmental Disability Services to put out a survey that went deep into the financial allocations for technology, the innovations that they're using, the areas that they would like to invest in, and the kind of the programmatic, systematic framework by which they are working in. So we are now into our third year of that study, And just in the 2019, just to give you a flavor for some of the results that we received from the 2019, was the states averaged 12 different funding authorities when they were purchasing technology solutions. I will tell you, in doing a lot of this technology first kind of in technology work over the years, I am less and less influenced that the funding is the rationale for why people are not using technologies. There are a lot of different funding authorities and ways that people can obtain funding for services that are technology related, but states were averaging 12 different authorities. The primary resource for the services and technology were HCBS funds, so that came under waiver services. We know that one of the challenges for adoption in technologies is what is the long-term supports of those. So that's the upkeep, the updating of any technologies, as many of you can attest to, I'm sure. Anytime you get an update on your iOS, life suddenly gets thrown out the window for a day until you figure out how that new adjustment and the iOS service has changed. But only 56% of our states reported that they were doing upkeep, training, and supports. Remote support technologies has increased, and this number has increased over the last couple months even. Remote support technologies, that's really providing supports from a distance, okay? When we talk about remote supports, we talk about it in a way of using things like sensors, sometimes video cameras, but not always, but providing supports from a distance. And so these states were reporting specifically using it for supported living, the 16 states. And then as we will see, and as I can talk about, certainly in light of COVID and what is going on in the states, what's being reimbursed in the states, telemedicine, telecare has increased significantly. In fact, what we're hearing is a lot of the states are housing some of their DD services under kind of telehealth, telecare within their states. But we've seen an increase in those kind of capacities. And then the final one that I always like to highlight, because I think it's really important when we start to look at systems, is that only 6 states were reporting that there was a consideration of technology in the ISP, in the individual service plan. And so this goes to kind of the importance of technology. It wasn't a mandated area, so it's only mandated in 6 states. But it goes to kind of the expectation of how technology should be used when we do or do not include it in an individual service plan. One of the areas that we've, really have encouraged and seen great success with is the state of Missouri and their Technology First initiative have required that within their individual service plan, people state why they are not using technology, as opposed to just checking off the box of saying, yes, we addressed it, we talked about it. In their ISP, you have to state why you are not using technology supports. So, the other area that we really wanted to get at with these states, because it gets at what is the future of technology investments and what they're going to reimburse for, is really where they wanted to invest. And there are several areas that have maintained consistency over the last 3 or 4 years. One is around remote supports, which now the states that have had some remote support infrastructure in place are able to roll that out rather quickly in light of COVID. Ohio, who is really the leader in technology first, was able to, they were reported looking at having over 200 people adopt technology, remote support technology in a week, which as a vendor is pretty shocking. Like, understanding the vendor capacity is pretty shocking, but so much of it was because they already had the infrastructure in place to make that happen. So when COVID, the implications of COVID were rolling down, they were able to ramp that up pretty heavily. Broadband purchasing, how do people get broadband? There are a lot of applications. The FCC has put out some easy ways to do that. Comcast has Comcast Cares that allows people to get broadband. With the advent of what will be 5G and small cells, we're going to see more opportunity for people to do broadband. Don't get me wrong, there are still isolated places where you cannot access, a Wi-Fi service, but they're getting fewer and further between. The other area is telehealth, teleservices. So we're seeing a lot of telemonitoring. So sensor monitoring, being able to have a feedback loop of what our healthcare information. That will align pretty closely with what we're seeing nationally in creating digital twins. This is a digital kind of replication of individuals in the healthcare service system to be able to track in real time what their health sensor information is reporting. Certainly transportation technologies is becoming a big one, knowing how to use GPS navigation. I'll show you some examples of some new things that are coming out. Share rides, share services. We just put together a policy and position statement for the ARC and AAIDD around technology and transportation. And so transportation technologies is really critical and how we are involved in the conversation. Certainly autonomous vehicles, what you're seeing on the screen here is the first autonomous wheelchair. So there are a lot of nuance in autonomous vehicles and what that's going to mean for us as an industry and a service. And then finally, that kind of indoor navigation, how do people navigate and use AR and VR in their services? So this is where states are looking to invest. When we asked them what they're looking to invest in the future, these are the primary areas. But then we get back to what have been the traditional barriers to technology adoption. Well, certainly this lack of universal design, which you'll probably hear a lot more about when we start to look at assistive technology, that there's this lack of universal design across the board of new developed technologies. We're getting better. Working with large companies, they are getting much better at understanding what universal design looks like for people with cognitive disabilities. We have a pretty good firm understanding on what it looks like, what the applications look like for those with sensory and physical impairments, but not necessarily for cognitive disability. Kind of the digital technology skills, we have not done a good job on really training and providing people with cognitive disabilities the skill sets, the digital skill sets, to be able to interact in a digital world. And so there's a lack of technology skills. Equal opportunity, there still is the misconception of people with disabilities can't function with technologies. Certainly if they're not universally designed, that's the case, but there's a lot of technologies that can be utilized and can be applied. Knowledge translation, knowing how to use a technology. I don't know how many of you have pulled out a manual that's been about that thick, 100 pages long, and went, yeah, that's not gonna happen. Well, you know, our knowledge translation is getting better. Understanding how to use plain and simple language as well as video manuals has been really helpful. But there's been a knowledge translation gap in between using technologies and applying technologies. Social context, where a person is, sometimes it's preventative to use those technologies in isolation. So I'm thinking of places that are group homes. Sometimes there's the social context that doesn't allow for people to use technologies in a more self-directed way if they have to negotiate what are other people's environments. That can be preventative. Systemic barriers, we'll talk about the funding, we'll talk about, you know, reinvestment of funds, etc. Failure to address useworthiness alongside usability, this is one of my favorites. So usability is really, if I have a wheelchair, it takes me from point A to point B. But useworthiness is really, but I want to use that wheelchair because it's cool looking. It lets me do things I may not have been doing before. So it's use-worthy, it's worth using. So we fail to kind of blend those two in the creation of technologies. And then last, but certainly not least, does come up some economic barriers. So what is the technology first movement? Well, technology first really began as a movement, but has now shifted. Very much like we've seen the other quote unquote firsts within our states, the employment first, now communication first, and we now have technology first. We have a lot of firsts in our states. And it's really become this framework for systems change that looks at the availability of technology as the first support option for individuals when they're creating person-centered plans. So not going directly to individuals to provide that support, but looking at technologies as alternative solutions for applications. So why are states really investing in technology first now? Well, the beauty of technologies first is it solves a range of different challenges that our service delivery system and our kind of field in general is facing. The first of all is it does help to promote self-direction, helps to promote autonomy. We have seen in states where staffing has gone from 2 to 1 to 0 staff in a household with a person who has gained remote support technology as a way of interacting with support. So we've seen people have really significant increases in autonomy and self-direction, as well as community integration. We've seen that aiding in community integration. It's been able to address some of the workforce crisis or the workforce shortages issue by really looking at how we have greater efficiencies and not replacing people, but looking how we can transform, how those jobs can be nimble and how they can really support. We can get out of this, what is the revolving door of care. So we need to promote care, we need to show care, then we get more service people in, and that's the best way to evolve. Well, that doesn't help us in promoting self-determination. It doesn't help us in promoting autonomy. By using technologies, we can make that shift. And it also has helped identify what we're now starting to track are more cost-effective, cost-efficient practices in providing delivery of services. So these are some of the challenges, some of the big challenges in our field where technology first has been identified as a solution to them. There are, however, many more. Some of the states engaged in technology first consortiums. So we've been running we've been part of and running technology first consortiums for quite some time, where it's basically a community of practice where states have joined to figure out where in their kind of context technology first fits. So technology first comes out of very different contexts and is applied in different ways based on what the environment, what the landscape looks like. So we do have 3 states who are using specifically the technology first language, Ohio, Missouri, Minnesota, but these are all the additional states who are engaged in some form of technology first advancement. When we did our last analysis of state directors on DD services, 88%, and this was the nation, 88% of them said they were interested in making it move forward. The other, remaining percent, 12%, said they just weren't sure yet. But most every state is interested in advancing technology first as an option. So what have we been doing? So the State of the States project has really been tracking what is technology first. And we've been able to see over the last 3 years, I mean, as I said, this has been probably one of the fastest moving initiatives I have seen in our slow moving DD services. But what we've been able to do is kind of track some of the trends, the gaps, and promising practices over time and come up with essentially a systems change guide for helping states when they want to make that investment do so. So really, what are the transitions they're making in their waivers? How are they redefining technology? As I said, terminology becomes a very critical piece in this. What are promising practices in the top down to bottom up kind of engagement of the community in this? And where are our gaps in knowledge? How are we demystifying tech? So one of the challenges has always been demystifying technology. And how do we do that in a way that really incentivizes people to utilize it? So this is just a broad kind of idea of where we have built the framework around systems change in technology first, and it's based on applied implementation science and human service delivery legacy systems, which, our systems are very difficult to shift because they're heavy in policy. And so being able to make that lift means transforming the system or intending to disrupt the system. And that's what the states that are really being successful in technology first are doing, is they're disrupting the status quo within their system of how to apply technologies. So, kind of the first steps, and I'm not going to go into detail on this. This is when we work with states, we do deep dives in this. But there are really some key elements. There's understanding the policy initiative, which really sets core values of what you intend to achieve through your initiative. Doing active implementation, that's talking about how do we leverage communication, how do we leverage our partnerships or collaborators, and build sustainable resources for long-term investment. And then, of course, certainly data-driven decision-making, data-driven fidelity of information so that we can really track what the impact is. What was fascinating is when we really started doing the NASDs, the National Association of State Directors survey, was when technology first launched. And so we've been able to kind of longitudinally track what that investment has been and how that investment has changed. We are also performing what is a triangulation of that data. So working with self-advocates and family members through self-advocates becoming empowered, the National Self-Advocacy IDD community, and the Autistic Self-Advocacy Network, some of those, as well as we'll be rolling out another component element with Anchor, which is the, and I always get their Anchor's acronym wrong, but they are the National Trade Organization for Service Providers. And so we'll be rolling out kind of that piece to triangulate this data to have a bigger picture of what's going on in technology. But so these are kind of the things we've seen be successful, promising practices, having a set core of values. Many of the states have adopted what is our Coleman Institute for Cognitive Disabilities Rights to Technology and Information Access as a kind of principle set. Having an advisory team, many of the successful states have put together a technology first advisory council to help guide and coordinate kind of activities. Resource allocation for that implementation team, which often comes with statewide legislation. The active implementation frameworks that we see is really having that loop between practice and policy. Much of the practice that we've seen with states is transitioning their waiver amendments and creating waiver amendments that transition the terminology or modernize, more specifically, the technology terminology to allow for broader applications. Leveraging collaborations, like you said, multiple industry partners. We've seen great partnerships with private industry, as well as startup teams in technology. And then capacity building. It's critical that we provide capacity building within state provider agencies to be able to look at technology. And some of that means having within a state or having within a service provider agency a technology driver or a technology director. This is not, I'm going to be clear, the IT person. This is the person who really focuses on technology solutions. And then data-driven decision-making. And we have a list of different data factors, mainly also looking at the quality of life outcomes. So are we increasing social capital? Are we looking at a variety of technologies used? What is the long-term utilization? And how does it impact causal agency or people's self-direction? So quickly, because I want to get through and allow time, I've got like 4 minutes watching. You know, kind of what is the role for technology in employment? And Wendy, I'm so sad we won't have our opportunity at APSI this year. We were gonna, I had the keynote for the APSI, the Supported Employment, Employment First Initiative, and how do we blend these two? But we'll make that happen. But really, we look at the technology, and as the Coleman Institute has always looked at technology, as filling the gap between this environment and personal context misfit. And so we look at technology as a bridge to that. So taking personal competence, people's skills, looking at the environment and being able to add a support in the middle that allows for productive functioning. So this is really the functional approach to disability, but it lays very heavily into the idea of where technology fits in. It fits in as a support to eliminate what are considered disability-specific implementation factors. So meaning, you know, what creates a disability can be eliminated through the appropriate supports that are embedded, technology being the key one. So what are the things that we're seeing? What are the exciting things we're seeing in technology and kind of employment supports? As I mentioned, we're hearing a lot now from states as they are shifting to alternative environmental application of services. So DAHAB is shifting pretty significantly, and that includes employment supports that are being provided both through vocational rehabilitation as well as through the DD service delivery system and agencies. But what are some of the things that we're seeing real strong applications of, and a lot of excitement around when people are looking at employment supports? Certainly when we're looking at the job duties, there are a lot of individual supports, technology, so have to be individualized technology solutions that are applied. One of my great friends will tell you that her favorite, she's a self-advocate and large policy-driven individual, will say that Grammarly is one of her favorite tools that she uses, even with email, to check her emails because spelling has been a challenge. So there are these kind of individual kind of supports that can be added. More that we're seeing workplace supports. So in the place of having what may be an immediately accessible job coach, we're seeing virtual job coaching, but also virtual supports outside of the job coach. So what you're seeing on the screen in the middle under workplace supports is an image of somebody looking at a virtual representation of something. We've also seen one of the primary utilizations of a surface called IRA. IRA is was designed for people who are blind and have low vision to navigate their environment. The two areas they see the most use is in workplace supports. So if they have something on their screen, they don't know what it is, they call the service helps them navigate that, as well as in the environment navigation. So there's a lot of ways to utilize technology for immediate kind of response of workplace supports. Certainly transportation, we've been using, our colleagues at IBLink have been using GPS navigation, wayfinding, but now there's certainly the AR, VR applications. What's on here is, Google Maps now has an AR kind of pilot that they're using that people can use to follow, basically following Pokemon Go. Theirs is the virtual fox, follow around for navigation. Communication as a predominant challenge for folks to obtain employment. There's a number of different services. Proloco is probably the most popular app to be used. Routine and reminders. So we call these really kind of functional reminders of what to do. We use them on our kind of Outlook, but then there's also routine watches, telepresence, which we're all engaged in. I think people are most excited right now on AR job supports. That's augmented reality job supports. In this image, you can see someone who's doing some electronics that it shows which kind of cable goes to which. That's an amazing support when you look at the application to our community, and then differentiated learning through online tools. But what is going to be critical for kind of what's happening now and what we've seen now in light of COVID? We've seen this shift from day program services in person to be more virtual. We've seen accessible online learning modules in light of COVID. Many people are doing online trainings that they weren't doing before. Augmented reality job trainings, so letting people use some of those technologies in home to learn about how to apply those skill sets or those tasks that are job related. Virtual job coach training started about a year ago, but we're seeing an significant increase if people have maintained their position. The data's now really starting to roll into our colleagues at Boston around who has lost their job, who's maintained their jobs through COVID, but being able to use virtual job coach. Applying virtual resumes and virtual portfolios for job obtainment and providing the skills. We've supported some of those initiatives. The accommodations, these are kind of the basic ones that have been in our tool belt for quite some time, but they're expanding to be more nuanced as well as be more broad in that other folks are able to use it. A perfect example of this is the live captioning tool that is in Microsoft Office PowerPoint now, where you can do live captioning by the click of a button using machine learning and the cloud. And then rideshare and virtual navigation. Those are, really helpful now in light of COVID. If people are trying to transition around, those are the areas. So what are the disruptive technologies for the future investment? We've tracked kind of the few. We expect our field to be a field that doesn't just reactive or responsive, but starts to drive what is needed. And so what are the areas we're really looking at and investing our time in? Well, certainly the promise of 5G. We started talking about the tactile internet about 4 years ago, which tactile internet, to give you some context, would be I could virtually reach out and give Wendy a handshake through the computer because we have haptic or tactile hand gloves on. So I would be able to feel her hand by reaching it out. The applications for that for folks with cognitive disabilities is profound. Artificial intelligence, certainly. We have had a big investment. We've had several consortiums on machine learning. Last year, we did another one on conversational agents, which is promoting the voice economy, which can be a challenge for folks with cognitive disabilities or aphasia or any type of local challenges. If we shift to this voice economy where everything is prompted by a voice, that's going to harm a lot of folks we work with. But how can we utilize that in a more meaningful way? Text simplification is becoming more and more prominent in ways that we can translate meaningful data to folks. So we have a project on what is accessible data information visualization. So accessible data visualizations, what does that look like for our field, for our consumers? And then decision-making supports. It's an area we're really concerned about because of the increased automation of all the tools we use. But how do we maintain self-direction through this kind of ubiquitous area now of automation of services, supports, and all of the things that we do. Mixed reality, we're working with a team out of Cornell that is looking at accessible mixed reality, that's XR. So that mixed reality is all the platforms, AR, VR, etc. Self-directed automation, as I mentioned, we're working on the ethics of data decision-making and ethics of large data and how to apply the machine learning ethics. Autonomous vehicles, and then finally, what is a big one right now that we had been kind of pushing a little bit on the states for some time, was this idea of really utilizing the connected communities and smart communities. We now have contextually aware systems that we can utilize that can identify if a person's been in their home for 10 days without talking to someone, and notifying somebody very close by to be able to share that information. So how do we do all this? Well, states are doing the technology first, but really at a kind of grassroots level, you've got to leverage and take advantage of the tech we know and can share. So if peers and those family members are using it, we push it. Building a culture of innovation, encouraging people to try something new and apply it, identifying kind of creative solutions, and building unique partnerships. You guys here are the innovators to create it. And I'm starting to lead my presentations with this quote because I think it's really important, because we're all afraid of technology to some extent. But particularly now, this seems to resonate that kind of in this era of everyone becomes a newbie, and we'll all be newbies forever. So we all just have to get comfortable with the fact that we're always going to be newbies with technology. And then what we need to survive, certainly now, is a capacity to adapt. So I know everybody's been incredibly flexible, nimble in this kind of COVID unknowns, and we just have to do more of that. And I want to say thank you to all of you. I know you're all on the ground level doing amazing things, and kudos to all of you for all of your hard work. So that's what I got for you, Wendy.
Thank you, Shay, so much. That was amazing. The information was so informative and helpful and innovative. I appreciate you sharing all of that. And I know people are going to have questions, and we'll have in a few minutes for that. And right now, Shay presented a lot on mainstream technology and innovative technology supports and solutions nationally. And now we have someone that is not a stranger probably to anybody here, but Jill Pleasance from the Institute for Human Development, our sister you set up at Northern Arizona University, who is the director of the Arizona Technology Access Program. And she's going to talk to us about actual activities related to technology and employment in Arizona, and also some ways that we can access primarily assistive technology solutions through the ASTAP program. And so I'm going to turn it over to Jill here. Are you there, Jill?
I am here.
Okay.
You can hear me.
Yeah, there we go. Perfect. Thank you. We're so glad to have you. Thank you for coming.
Thank you for asking me. So I am the Associate Director of the Institute for Human Development. That is a relatively new position. Prior to that, I've been the director of the ASTAP program going back to 1999. So this is a shift, and I still oversee ASTAP. We're actually in the process of hiring a new director for that position. So I just wanted to talk a little bit about ASTAP, and then, you know, Shay has this big picture, and mine's a little bit more, you know, in the trenches and things to think about with technology. So I'm going to share my screen. Okay. Gotta go back. Okay, so ASTAP, the Arizona Technology Access Program, it's a Phoenix-based statewide program of IHD. We're funded under the Assistive Technology Act that was first enacted under a different name in 1989. And we've been operating since 1994. The program moved around, originally from Tucson, then Flagstaff, but we've been in the Phoenix area since 1999. But our scope is statewide. And every state has a program similar to ours that we all have to provide certain services. And most of what we do is free. So our core services include providing information and assistance, demonstrating devices, lending out devices for short-term use. And those two activities, demonstrating and lending devices, they do have different purposes. But when we report our information to the feds, they're looking to see, did we help people make decisions about what technology works or does not work for them? We meet individually with people, you know, people with disabilities, family members, service providers, to help understand what their needs are and to help them navigate that decision-making process. Now, we do AT assessments. Full-blown assessments are done on a fee-for-service basis, but our consultations, which are pretty close, except that they don't result in a big report, those are at no cost. We have a number of different online equipment reuse programs to help people obtain technology in a less costly manner or sometimes for free. We do a lot of training and educational technical assistance we do to agencies and organizations, but training can be individualized. And then of course we do large scale and small scale educational events. And we also have an affordable financial, low cost or low interest financial loan program for people who want to buy technology and are able to take a financial loan. And we do serve all ages and disabilities. So while employment is one part or employment related, we work with early kids receiving early intervention services, educational services across K through 12. We have within our lending library probably close to somewhere around 7,000 different devices. And we also run a lending library for Department of Ed. So really, there should be nobody in Arizona who doesn't have access to trying technology and learning about it. I mean, obviously we don't have every device on the market, but we try to keep pretty current, and we have resources for getting things that are not within our own inventories. So these are our services. Of course, with the COVID-19 situation, we, like everybody else, are working pretty much virtually, but we are still lending out equipment, and we're still doing consultations, and we're doing virtual demonstrations. But when we talk a little bit about AT and employment, one of the things that we see at the ASTAP office is that AT and technology in general, you know, I mean, AT has a legal definition, but I don't think that it's being considered early enough or consistently in the employment planning process for people with disabilities. We often, now it may be, and maybe those things, everything goes smoothly. What we tend to see are, I'm about to start a job, I don't have technology, or the person's on the job and things aren't working. So my advice for you on the phone is, as part of that planning process, AT and technology should be considered really early on. Those conversations have to take place not at the end, but at the beginning. And helping people determine what's the right AT for the person on the job is based on gleaning and gathering information about the person. What are their strengths, but what are their challenges? What have they tried before? What worked? What didn't work? What do they want to be able to do? And Shay mentioned environments and contexts, but the other piece too is tasks, job tasks. What is it that that person is going to be expected to do on the job, and either what tasks or what parts of tasks need to be analyzed to see, oh yeah, the person needs technology to be able to do this. They may not need it all the time, but they may need it for a part of a particular job. And the environment. So, the big picture, can they even get into the building? Because, as Shay also talked about, we don't have universal design in everything. So is it, do there need to be accommodations to get into or onto the job site? Is it in their own office? Is it, what environments need to be considered? So when you're looking at technology, it's the constellation of the person, the job tasks or activities, and where they're going to be needing the technology. And remember, if somebody requires a source of power for whatever technology they're using, how is that going to be managed? Some things that are going to work inside may be a little bit more challenging to put into place if they're in an outdoor area. And again, things like broadband, they're going to have access to those things. So, there's not like a technology evaluation. It's more of a process that takes these things into consideration. And I would say that it's particularly true that there's a tendency to overlook technology when the person's disabilities are less apparent. And I've seen this at all levels when, we've been at events with school districts, and they'll come up, when we've had displays of technology. No, we don't have students who need that. And we'll say, well, do you have students who can't read? Of course we do. And so that changing that mindset of, if it's not obvious, they don't need technology, to like, well, what's difficult for that person, and how can we compensate for those things, and how can we build on the person's strengths? So, and it's not only technology. So once it's determined what the person needs, then in order for it to be successful, you've got to have appropriate supports. And that means that who's ever using the AT or even the mainstream technology, are they trained to do it? If they have job coaches with them, or other co-workers who might be involved, do they know how this device works? What other strategies are there? I use the technology with some things, but I have other strategies that allow that person to be successful. And then follow up, because technology fails, or as Shay said, updates. Is the device not working because there was a system update that nobody knew about? So that's an important component of having the technology be successful, and then the person be successful. So this was just a little, let me whet your appetite to what ASCAP does. We're not the only AT organization in Arizona, but we're probably the largest and broadest. And there are other resources for looking at employment accommodations, such as the Job Accommodation Network. But we would like more people to call us and say, we're planning for employment for this person. Here's our concerns. Can you walk me through that process, or can we borrow equipment? So to that end, this slide has contact information. We have a general email, askascap@nau.edu. We have our website that every item that we have is on there with a picture. You can make a request online. all of that does not initially have to go through person-to-person contact, although we're happy to, take calls and when we can reopen, have people come into the office. And then I've got my email and my direct line. So I'm going to stop now and I guess turn it back over to Wendy. Let me stop sharing.
Yeah.
Thank you so much, Jill. This is Susan Borrell. We really, really appreciate all of that coming together from both of you. That was really rich information. Since we really are down to 8 minutes, I'm going to quickly ask, so if you've been following us on these, you know that Krista Mackey, the administrator for the Rehab Services Voc Rehab program, is on. Adam Robson, from the Employment Administrator from Access, and then Nicolette Fidel, the Deputy Assistant Director for DDD, as well as Margaret Corcoran. So because we're short on time, the agencies, if you'd be willing to just quickly add anything, if you heard anything that you don't think Arizona can do or funding, do you see any issues with us moving forward with anything that you heard today? I think that that's kind of in the context or, in that way, if you guys could answer just very quickly, and then we'll wrap up with a quick survey that we're going to share with you guys. Sorry for the time. This was great information. So, Kristen, do you want to add anything? Did you see that you heard today? That would be any issues with?
No issues other than, Tech First, the super exciting information, and I learned quite a bit, so thank you for that. And, Jill is a part of the State Rehab Council. We have conversations frequently. We have tried to, starts and stops with some other opportunities to use ASTAP in a more substantial way for VR so that we can really start to explore what those tech needs are for people in employment, to the extent that it's earlier versus later. So no issues, and, really recognizing that technology is a very important part of the work that we do to help people gain employment and maintain their employment.
Thank you, Kristen. Great to hear that. And as everyone knows that my role is Employment First, we talk about assistive technology being one of the #1 things that levels the playing field for anybody with a disability any level. Jill and these folks, and lots of you guys have heard me say that for a very long time. Nicolette and or Margaret, anything that you guys saw as any issue? Yeah, it's the same thing around the DDD population, individuals with developmental disabilities.
Hi, Susan. I don't believe that Nicolette is on. I'm not sure. But I think it's really exciting. I did, just like Kristen said, I learned a lot today too. And I think it's something that the division is very interested in, very open to. We do have Burns and Associates who are helping us develop some network development, some recommended revisions to our services, and this is something that they can certainly look at in terms of looking at our services, looking at, I think it's very interesting, the whole concept of technology first, really incorporating that right at the beginning of the discussion of employment services and developing the ISP. So I think it's very exciting, and I think it's something that, philosophically the division is very supportive of. And we will certainly look at it and look at, how it's reimbursed, figure out how we can possibly incorporate it into our delivery service system.
Thank you, Margaret. And Adam, did you want to add anything from the active Medicaid perspective? Yeah, please go ahead.
Yeah, and just like what Margaret said, a lot of it's going to be dependent on the future of telehealth services. As we move forward, as you know, they're kind of in the temporary list right now going forward. But we don't know what the future is going to look with that. But yeah, it's great material. Really interested to learn a lot more about it. And definitely something that we would be on board with.
Okay, excellent. I mean, with 3 minutes left, I know there's a question, but I'm not sure that we can get to it unless, Wendy, you feel like we want to do that. What I will say as we're thinking about that very quickly is we're going to put a link in the chat box, as well as Jeff, do you want to throw up on the screen a survey link and a QR code that we'd really appreciate any feedback. This will also be on our landing page. Hopefully those that have been on the series know we have a landing page for the series of webinars that you can go back and listen to. Here's the evaluation piece. And as we said, we're going to start giving, for the participants that actually, came into the webinar, we'll provide you guys a certificate of completion at some point in this series. Yeah, somebody jumping in.
Could the one question in the chat box, could that be brought to Shay's attention maybe real quick?
Yeah, go ahead. We can ask it. Jeff, did you want to ask it? Or somebody, or did you see it, Shay? Can you answer it?
Yeah,
you want to summarize?
It's got quite a bit of different components in it. So, let me start with kind of the first piece. And part of it is changing the dynamic of control when folks are in group homes. And that's where, there are some challenges. Certainly, if we've heard folks who have said, so-and-so wants to use Siri, but another group member in their house doesn't want their voice being captured. How do we deal with their privacy and, security in that situation? I think a lot of what we're finding is that first you have to start to change the culture within a delivery kind of an agency. And a lot of that is trying to look at what are these as solutions. And then, certainly respecting people's boundaries, but knowing that if someone's choosing to use a technology, that is part of their self-direction. That's part of their self-determination. And how do we do that? Much like how do you borrow somebody's, things that are in a group setting. So I think there are these added components that are concerning for, certainly the requirements that fall under HIPAA, which has been relaxed now, which will see some really great, I think, shifts in services after this. But there is, I think the first thing you have to do is start to change the culture within the agency. Allowing people to have more control over the solutions, the technology solutions they want to use, and then starting to navigate around that. And yes, we have also heard the same sort of thing where there are guardians who do not want utilization of technology. I will tell you, part of that is the demystification of technology utilization, and where there has been great success is being able to showcase in a video format or in some other format, other success stories that helps to demystify the technology and opens people's eyes. So we've seen a lot of the success has been around people, and agencies creating materials that help to demystify and promote knowledge use of what technology applications look like. And oftentimes it's just people's lack of awareness and knowledge on what they can use. And so I think those two things become the key in transforming how people apply technologies.
Excellent.
Oh, thank you so much for taking the time to answer that. And Wendy, I don't know if anything last minute, we're over time.
No.
Just always grateful for the coordination, collaboration, for all the efforts in Arizona and all the national folks. And Wendy, any last minute?
I just want to thank everyone, and thank you so much, Shay and Jill and everybody on here. We so appreciate it, and great information. Have a wonderful weekend. Stay safe, and we'll see you in 2 weeks.